Hey, good afternoon, students. Hey, just want to briefly go over something with you. It's going to be a short video and want to just talk about something that you all will be dealing with when you guys are getting ready to come up on respiratory emergency. So we'll do a short video here just to kind of help you along. Maybe we'll do a couple of more in spurts as it relates to just general information on things that you need to know. And hopefully these videos will be helpful for you. Just want to go over something such as asthma. Okay, but before we get into asthma, a lot of the things that I want you all to start looking at in your respiratory emergencies, because we will be dealing with signs and symptoms, obviously, and management of respiratory emergencies, including those emergencies that will affect your upper airway, as we talked about in the class once before, lower airway physiology, pathophysiology, anatomy, which we talked about also. And then the other thing, what we have just recently started, which is the assessment, right? And assessment and management of these particular systems, right? Such as epiglottis or epiglottitis, excuse me, pneumothorax or pneumothorax or spontaneous pneumothorax, pulmonary edema, right? And of course, the one we're getting ready to discuss just briefly here is asthma. And then also, I want to go over something later on when you guys get ready to start class. Once again, is pulmonary embolisms and things mainly affecting, again, your respiratory system. Okay, so if you recall, just recently we went over a couple of things in class as it relates to assessment, but we were also talking about um, respiratory emergencies once before, or the anatomy of your respiratory versus the top upper airway versus the lower airway, right? And if you all recall that. So, with that being said, I just want to have a brief video. This video is probably going to be roughly about 10 minutes, 5 to 10 minutes or so. And I just want to ask you a question, because what I need you to do is start looking at the information I just provided in reference to those systems, such as, again, pulmonary edema, um, pneumonia, asthma, which is what we're covering now. And I just want to show you a couple of things as it relates to those things, because again, you may have not seen that, or you may not know what that looks like. So I'm going to give you an example today in this brief video here. So what I'm going to do now is I'm going to try to share my screen, and initially I want to talk about um, dealing with um, your respiratory system. Okay, so just bear with me here, and I'll see if I can pull it up. Okay, let's see here. This to be moved to the side a little bit if I can. You should be seeing what I'm seeing here now. And so one of the videos is I want to introduce you to here. This is right here. I'm going to show you two brief videos. This right here is when you have the working of the accessory muscles and respiration. So I want you to take a look at this young person's breathing pattern, and you can see how he's using his accessory muscles when talking about respiration. Here we go. This video was taken. Okay, so as you can see there, the child is definitely using uh, those accessory muscles there. And so, just to give you an idea of what that may look like, uh, I wanted to show you that video there. Now, let's take a look also at accessory muscles. Let's see if I can go back to the beginning here. And I want you to see an adult using some of their accessory muscles as well. We won't do the whole thing, but you can see here in this video as well. know that. All right. So look at his neck muscles there. Now, obviously, he shouldn't be working that hard to breathe, but I just want you all to be able to see um, the accessory muscles or another part of the accessory muscles in the uh, neck region here where he's having trouble or working hard to breathe. Now, you must know that the body won't be able to keep this up for so long. Um, what you heard in the last video there, where the little kid was about to get ready to be intubated, okay? You won't be able to keep that up for so long before you're getting some sort of treatment and or help. Okay, so just want to get you guys to get a chance to hear, look at that, and also see what that is going to be like when you're out in the field. Okay, so we can give you some of these things, some visual cues to show you what those things look like. Now, here I want you to remember, as we talked about listening to lung sounds, if you all remember, I just gave you a portion of your assessment when we were doing medical assessment and trauma assessment, right? And we talked about where we're listening to the lung sounds, right? We talked about right midclavicular, left midclavicular, right axillary, left axillary, okay? These are the areas. But just to remember also, too, all right, we got to incorporate what are we listening for. All right, so I'm going to play this video, which is 2 minutes long, okay, and let you see what some of these breath sounds would sound like with a person who has diminished or who does have asthma, but also is having diminished sounds of asthma with this video. The presentation clinic adds, although wheezing is often associated with asthma, remember that not all wheezing is caused by asthma, so we got to remember that as well. And not all asthmatics present with wheezing. So everybody doesn't present with wheezing just because they have asthma. And they're going to give you some examples here. Early asthmatic coughing and shortness of breath may be the first findings. I think it's in a way here. Inflammation obviously worsens as it progresses. The airway begins to narrow. Airflow obstructions ensues. The airway is narrowing, can lead to fainting, wheezing, okay, scattered throughout the lungs, as you can see on the left. As severity of progresses, listen to the sounds. All right, you can see as severe as it get, you're hearing less and less breath sounds. If you can barely hear the wet breath sounds, excuse me, not wet, but breath sounds, you know it's very severe. All right. So this is just an example here, right, of what you may hear. Okay. So I'm going to back out of this here if I can. There we go. I'm going to back out of this here. What I'm going to do is, what I like to do is read a scenario to you. Okay. I'm going to talk about this scenario just briefly. All right. And then I want you to kind of look at this video and then answer these particular questions that I'm going to discuss with you. Okay. Let me make sure I keep that paused. All right, let me stop sharing now. And I want to, let's see, where's my information? Okay, so I'm going to read a scenario to you and just think about this here, all right? And what a scenario is dealing with respiratory emergencies as well. It said it is mid-February, and you respond to a local movie theater for a 42-year-old male with respiratory distress. Says upon your arrival, you and your partner are directed to the lobby where you are observing a patient who appears to be having trouble breathing. The patient is leaning forward and speaking in short bursts. Okay. You notice the patient is using his accessory muscles in his neck and needs help breathing. The patient informs you he was standing outside in the cold for over 20 minutes waiting for a friend. He has a remote history of asthma, but he has not had an attack in several years. The patient denies any other past medical history, takes no medication, and has no allergies. Vital signs show a pulse of 106 beats per minute. Remember what the normal breath pulse rate for an adult person is. Respiratory rate is 26 breaths per minute and labored. Remember what the breaths, normal breaths for an adult patient is. Blood pressure is 142 over 88. Remember what a normal blood pressure is for an adult patient as well. And the SpO2 is 91% on room air. Remember what the normal SpO2 rate that we've discussed is. Okay? Your physical examination reveals obvious accessory muscles used to the chest and neck and diffuse wheezing in all lungs. Let me read that last part again. Your physical examination reveals obvious accessory muscles used to the chest and neck, like we saw in the little kid and in the older person neck area, and you hear diffuse wheezing in all lung fields. All right? So let's start off with a question here. Number one, which of the following medications can be used for the treatment of this acute asthma patient? A, Kremlin, B, albuterol, C, flutangos, or D, Similarol. All right? What do you think the answer is for that? Okay? What do you think the answer is for that? Number two, which of the following statements is true regarding asthma? A, asthma involves accumulation of air in the pleural spaces. B, asthma involves a collection of fluid in the pleural spaces. C, asthma involves spasms of the bronchi and bronchioles. Or D, asthma involves a collection of fluid in the alveoli. Okay? And just in case I read the two, A and B, the same, I'm going to read those two again. A was asthma involves accumulation of air, and then B was asthma involves a collection of fluid in the pleural spaces. Okay? So I wasn't sure if I said the same thing, but that's what it is. Number three, the patient is exhibiting signs of respiratory distress, such as accessory muscles used and difficulty speaking. Which of the following is also a sign of respiratory distress? A, pursed lips breathing. B, respiratory rate of 16 breaths per minute. C, warm pink skin. D, clear and equal breath sounds. Okay? So in order for you to answer these questions, you got to know what these things mean. Number four, you ask your partner to administer oxygen therapy. So you're going to have to give this person some oxygen, correct? What is the most appropriate method of oxygen delivery to this patient? A, is it a nasal cannula at 2 to 6 liters per minute? Is it B, non-rebreather mask at 15 liters per minute? Is it C, venturi mask at 8 liters per minute? Or D, is it a bag valve mask at 15 liters per minute? Okay. Number five, when assisting a patient who has asthma with a small volume nebulizer attached to oxygen, what is the appropriate flow rate for the oxygen? Is it A, 2 liters a minute? B, 4 liters per minute? C, 6 liters per minute? Or D, 10 liters per minute? Okay. Number six, in addition to asthma, which of the following conditions is associated with wheezing? Is it A, the croup, B, epiglottitis, C, pulmonary embolism, or D, bronchitis? Okay. All right. Number seven, while administering a nebulizer of albuterol to your patient, you assess for a possible side effect to the medication. Which of the following is typically not a side effect of nebulized albuterol? which typical is not a side effect? Is it A, vomiting, B, increased pulse rate, C, nervousness, or D, muscle tremors? All right. So we want to stop it. I'm going to stop it right there. So I want you to kind of think about those questions that I presented to you. Think about a person that's having asthma. Think about all the information that we've discussed in class thus far concerning airway. All right. Having a patent airway. Is the airway open and clear? Right. Um, what's the normal breathing rate for a person? Right. For an adult patient. All those things we've discussed thus far, okay, you should be able to answer these particular questions. All right. What I would like to do is when we come back to class, I would like to discuss these questions here. And I hope that you all have taken the time to go back and review and look up some of this information so you can just have a discussion about it in class. All right. So we're going to go ahead and close down the video for now. We'll create more videos just like this here, and we'll just have discussions in class talking about it. I chose not to view the information because I want you to all just think about what it is that I said as it relates to the information that was presented to you. All right. So until next time, students, we'll have another session or we'll have another brief recording as such. And I hope you continue to further your mindset and open up your mind and take a gander at the information in your books concerning respiratory emergencies. Until next time, we'll talk to you then.